Welcome, everyone. This is session 103. We are pleased to have Nisha Daniel, and she will be speaking about From the Dental Chair to the Data Cloud, Thriving in an Interdisciplinary Environment. Nisha Daniel is a dentist and a health data scientist with a unique and interdisciplinary expertise. She's at the intersection of data and public health, through her fully funded postdoctorate studies, being an Edinburgh Global Scholar 2023. Her work focuses on leveraging data science methodologies such as machine learning and public health informatics to address pressing oral health challenges. Nisha has applied her skills to projects ranging from community oral health programs and oral cancer screening to digital health initiatives, showcasing her commitment to using data to drive equitable and impactful health outcomes. She's a recognized student leader and a passionate advocate for her interdisciplinary collaboration in healthcare. Being a dental healthpreneur, she's also has valuable publications ranging from a scoping review of oral cancer to data ethics and implementation assessment of public health policies, while pursuing research in the data science of dentistry. Please join me in welcoming Nisha Daniel, and we are excited to hear your presentation.
Thank you, Cynthia. Greetings to you all from India. Okay. I feel encouraged and humbled to introduce myself on this amazing occasion of International Day for Women Data Scientists and Statisticians, as we are going to listen to my journey from the dental chair to the data cloud, thriving in an interdisciplinary environment. What do a dental drill and a data pipeline have in common? Globally, 3.5 billion people are affected by oral health diseases, thereby becoming the highest non-communicable disease burden globally. As a clinician, beyond providing treatments, I've conducted anti-tobacco campaigns and free community oral health programs, including among disadvantaged groups like Special Children Leper Colony, where I have witnessed issues of accessibility, affordability, and availability of oral health care. Ever since, my leadership is directed towards building a digital dental health startup, which comprises of AI-led ambient scribing and teleconsultations. And this perseveres to achieve UN SDG goal number 3, universal oral health coverage by 2030, in line with the World Health Organization's public health approach to oral health through digital technologies. And the statistics is from WHO Global Oral Health Status Report 2022. So in the beginning, when God created the world, God didn't want the world to just survive or be there. He wanted it to thrive. So when he wanted to take it further, he created a woman. And thereon, we are celebrating Women's Day for whoever we were. Imagine a vibrant tech conference where brilliant women data scientists and statisticians have completed a massive artificial intelligence blocks. And they prove that the future of data science is truly for everyone. And our leading scientists would stay. We are a bit busy building a world where our data models don't just predict, but we are creating an equitable algorithm and solving global challenges. So on this day of International Day of Women Data Scientists and Statisticians, we celebrate this future that isn't just bright, but brilliant, diverse, and frankly powered by a whole new set of roots. History and contemporary research show that women often build strong, supportive networks that serve as a source of mentorship, encouragement, and professional advancement. And this focus on relationship building and collaborative problem solving is a core strength. Resilience, that's born from navigating societal and professional challenges. They allow us to persevere and adapt in a constantly changing environment. And our leadership style is more empathetic, inclusive, and we are fostering environments where diverse teams can flourish. And a data scientist thrives by mastering a blend of technical expertise, domain knowledge, and effective communication. They must be proficient in languages like R, Python, or understand machine learning algorithms, and be able to manage and clean complex data sets. However, what separates a good data scientist from a great one is that their ability to understand the real world problem. Yes, a deep understanding of the business or the scientific domain. It allows us to ask the right question, build the right model that provides meaningful and actionable insights, and also the skill of translating complex findings into simple, compelling narratives for technical stakeholders is essential for making a tangible impact. While the title data scientist is a modern one, the work has been done by pioneering women for centuries, from Ada Lovelace to Grace Hopper to Katherine Johnson. And what we learn from them is how to define thriving. It's being beyond survival. And how did these women thrive? They thrive through learning and adaptability. Yes, continuous learning is important. Embracing new skills in Python or machine learning can be a source of empowerment. Uh, and just as a dentist masters a new instrument, a data scientist masters a new algorithm. And thrive by leveraging your uniqueness, that is, your non traditional background, is a powerful asset. My clinical experience allows me to operationalize patients' needs into testable data hypotheses. So is yours. Whereas you are in the humanities, arts, or a different scientific field. So go find your tribe and the psychological safety that comes from the supportive community or even a online forum. In the dental health ecosystem, most of the time there isn't a record for patient medical history. And by this I mean electronic health record, EHRs. Physicians spend a significant portion of their day, up to 50%, on clerical work, data entry, navigating complex interfaces, and this leads to physician burnout. And if this is not customized, EHRs can disrupt existing clinical workforce. And the need for manual data entry, the multiple mouse clicks, all these are a major source of frustration at the clinic setup. And also a lack of uniform data standards, a fragmented ecosystem of different EHR systems. All these make it difficult for information to be shared between the practitioners or even between different health systems. And the complexity of the present EHRs is often, it requires extensive training, and that it itself is a barrier for adoption, and it drains the resources what we have for healthcare practices. And manual data entry, it leads to typos and data inaccuracies, and they also have significant consequences. The focus on screen-based data entry, it leads to desktop medicine, where the physician's attention is mostly on the computer screen and not on the patient, and that negatively influences the patient engagement, patient satisfaction, and all. And modern voice to text systems are capable of handling continuous long form dictation. They use ambient listening, natural language processing NLP to structure the conversation into a coherent one without the need for pauses or even verbal commands. So, some systems are also trained to handle multiple speakers, so they separate the physician and the patient voice very easily. And the key to this technology is that they're designed to create a ready to sign chart that reflects the natural flow of a conversation rather than a robotic interpretation. And this helps the physician reduce the documentation time. So physicians can speak even 3 to 5 times faster than they can type. And this allows them to see more patients, and also they can reduce their workload by this. And this improves the work efficiency, the workflow. It allows physicians to naturally consult with a patient and give a lot of patient care, which leads to patient satisfaction. And it also reduces the major cause of physician burnout because of this administrative issues. And also with this, we get a hands and eyes free approach. And this eyes free, the eye contact, it helps focus on the patient, and there is better communication and better accuracy. And also the documentation is become more and more clear. So dental clinics, they need this hedgehog concept. The change management process here, it occurs at the individual, team, and organizational levels. The data-driven innovation lies at the data collection stage of the data lifecycle and plays a significant role in improving the quality of the practice. Such a data-driven innovation in health and social care, it improves the quality of the practice and also integrates data science directly into change management. And it demands true and authentic leadership to achieve operational excellence, sustainability, and transformative, high quality, efficient health and social care services, not only for individuals, but also for the populations. And other potential solutions, such as improving the organization for paper records or hiring additional staff for data entry, it does not address the fundamental limitations of accessibility, data analysis, or security. It only increases the operational costs. And the type down kind of health records, they're only causing silos. So initially we write down on the paper, and then we spend a significant time to enter it into the computer. And this still results in considerable potential for duplication or overlap or even confusion. And as this data driven innovation champions the core principles of accessibility, confidentiality, data privacy and security, scalability, interoperability, replicability, and even transparency. So, any inaction can lead to a delay in achievement of the final health system goals, like improved health status or financial risk protection or even patient satisfaction. So, without this data driven innovation, efforts can become fragmented and resource can become misallocated, and even the potential for a positive impact on health outcome can become significantly diminished. And strategic alignment. Strategic alignment is about creating a cohesive and synergistic system, ensuring that all organizational activities or efforts or resources, all of them are directed towards achieving the overarching strategic goals. And ultimately, that will lead to an improved health outcome of the patient health or the population well being. So, implementing a data driven health record, it improves patient care and operational efficiency while contributing in massive to the health system. And true leadership in the fast moving world of digital health, it isn't about following trends, but about building trust, about working together and making meaningful change in healthcare. And they need to connect the dots between data and compassion, innovation and equity, and the future of health demands vision, integrity, and a deep understanding of the people it serves. And the strategic alignment is strong with the organization's vision, mission, and values. They are directly and more than just the technological adoption. There is also quick delivery of continuity of care, because oral health itself is a gateway to the systemic health of individuals. And also, this EHR studies show that they have resulted in reduction of in-person visits by up to 26%, and also replacing physician visits by telemedicine or teledentistry, it can result up to 40 to 70% reduction of carbon emissions. And that can help the commitment of the manufacturer also towards environmental sustainability. And that also is well aligned. And how we do this? So disruptive innovation, it needs strength and courage to overcome barriers. And we need to upskill both clinical and non-clinical staff to address these concerns and resistance. We need to enable actions by removing these implementation barriers, which may be technical or sociocultural or economic, or there is a resistance to change in itself, or even security. Change is necessary for evolution. And to be uh, very precise, we need to be careful when this change is happening, because in the long run, this can lead to fatigue, and this fatigue can lead to loss of compassion in itself. And while actually checking for the responsiveness of the system or the co-workers, we also should take care that we do not use authority to create change. Nevertheless, we should assure the staff constantly that this change is not going to change the core principles of teamwork or professionalism or fairness or even the patient treatment outcomes or the health outcomes. And these things will not change, and we should assure that we have to make them accept the change behavior and make them anchors of stability and stewards of identity. Members, and they need to be effectively bridged using this digital technologies, and we need to make sure that all these changes will the 5 dimensions of quality, that is assurances of integrity, methodological soundness, accuracy, reliability, serviceability, accessibility, and all these are essential while moving towards change. And also, we can anticipate that a change in power distribution can lead to conflicts. So, we need to have a conflict management plan always in handy that can ease tensions in the workplace. And also, work flow changes. It can affect the work timings or skills or efforts, but we need to make sure that the employees are properly incentivized, either monetarily or by non monetarily by giving awards or any other encouragement. And also, we need to accept that over dependence on technology itself can arise, where one day if there is a power cut, it may look like the whole workplace has ended. And also initial hiccups like the time consuming nature for adoption, all these things has to be taken into account. And also these questions like, is this change really necessary? Can this change be implemented successfully, or what does it have it to do with me? And all these should be effectively managed. And we need to look into Venus model, and also we need to look into the change leaders capabilities. Armenakis in 1993 talks about the change leaders capabilities like expertise, trustworthiness, credibility, authenticity in bringing about persuasive and direct communication. Also, we need to use tools like dialogues, storytelling to engage the people or the staff members. And also, we need to manage internal and external information in a very authentic manner. And we also have another tool called as Lewin's force field analysis, and that can help in analyzing the driving force or the constraining force for the change to take place. And we can take the view of either increasing it or decreasing it. So the currently the pen paper method which we are using is strenuous, even while storing it or even while reviewing it. So we prefer the Kotler's 8-step change management approach. So this talks about the 8 steps, the first being creating a sense of urgency, a compelling reason to change. We need to act quickly, and this is the mindset we need to instill in the staff members to create this change management process. We need to highlight the inefficiencies of paper-based records. It can be slow retrieval or the lost record itself. There is a risk of even illegible handwriting, or time is wasted on manual data entry. At the same time, emphasis should be made upon the benefits of the voice to text EHRs, like faster documentation, improved accuracy, or enhanced patient care, and also the potential for data analysis. Along with, there is a strong industry competition surrounding it. And the second approach is building a guiding coalition and overcoming any resistance by forming a team of stakeholders: the dentist, data scientist, dental hygienist, or administrative staff, and even some of the patients can be levered in. And they can ensure credibility with clear communication channels. And we have to incorporate diverse perspectives and also a shared commitment among all these stakeholders. And also, we can still use the tools like dialogue individually or by collective storytelling. And this can help in the change process. And this also allows a seamless transition across different care settings. It reduces fragmentation, and also it improves patient experience or even outcomes. And the third approach being having a clear vision, a strategic vision and initiative, a streamlined clinic with specific software selection or a hardware procurement, staff training, data migration. All these should be planned, and there should be established milestones. And from this, we also need to enlist a volunteer army, and we need to encourage participation from all the members and from all the stakeholders. And this is very crucial for successful change. Freeman in 2006, he talks about this, how the stakeholder perceptions and experiences of the innovation is very important to the extent of change to the services or even to the outcome. And also, we need to build a momentum in a phased manner. We need to give short term wins, and we need to reward the staff members who adapt quickly. At the same time, we can track the metrics. And then we need to overcome the barriers, and we need to sustain acceleration. Continuous improvement methodologies. We have an example of Kaizen and Lean methodology. It emphasizes on ongoing refinement by gathering feedback from dentists and patients, so that there is always a warning against complacency. And also, new practices will be embedded with this new technology, and both intended and unintended consequences of the innovation are always on the list, and we are able to include more users and widen the system. And finally, keeping an eye on the time, we are institutionalizing change. We're integrating the voice to text system into the clinic's SOP, standard operating procedures, and we're updating policies and procedures to reflect the new system while constantly using it. And there are still criticisms on this. Critics argue that this model is too linear, there is limited flexibility, and also it has a top to down approach, and that is not always suitable in all circumstances of change management. But I believe to thrive in an interdisciplinary environment, we are going through this digital transformation. We need to keep change in the center of our processes. In concluding, women data scientists can uniquely thrive by leveraging their strengths in emotional intelligence, collaboration to excel in a technical field. By building and nurturing strong professional networks, they can create supportive communities that facilitate knowledge sharing and mentorship. They can also use their empathetic approach to better understand user needs or ethical consideration of the data in itself. And this leads to a human centered and socially responsible solutions. This dual expertise, either the technical rigor or deep understanding of the human behavior and this collaborative mindset, this positions us to become not just experts in the field, but also influential leaders who can drive inclusive and ethical innovation. And going forward, we need to optimize for digitization and substitution, because this digital health solution, it contributes to the implementation of the UN SDG goal number 5. And this EHR, it is based on the data science process itself. But for this EHR to be successful, we need to take care that the intended paper substitution efforts happens. Rebound effects, such resulting from paperless environment, they has to be avoided, and any access, transferability, readability of the digital copies, interoperability by HL7 or other international standards, and also enabling web-based desktop usage of EHR apps, and by driving the integration of document exchange functionality of the EHRs with doctors or hospitals or specialists or payers or even pharmacies or even with the patients themselves has to be taken care of. Nevertheless, managing and stabilizing the achieved change itself is a challenge in itself, and we need to manage this transition effectively, and we need to deal with the organizational cultures while managing their policies during this change process. We can take into note Carnell's change management model of 1990, and we need to understand that change is everyone's responsibility. Thank you.
Thank you very much. Please do add your questions into the chat for our speaker. As we are waiting for any questions to come in, I was curious, Nisha, about what you view as potential data challenges with moving to an EHR from having just masses of data. Do you anticipate that also being a challenge in addition to the other issues like privacy and change management and patient satisfaction that you pointed to?
I'm sorry, can you come again?
Yes, I was curious if you feel like the large amounts of data that will be part of an EHR would also be one of the challenges in the implementation, in addition to some of the other challenges that you spoke of regarding privacy and patient satisfaction and change management. So like it's a big data issue if you've got
yes.
like a lot of data to manage.
Yes, sir. So managing data from the UK background, we have this NHS Safe Havens 5 Safes framework, this Appendix 2, which I've displayed here. And we have to take care of the data management at each level, data management in terms of security, in terms of privacy, in terms of storage. And also we need to take care that the local storage happens and there is no cloud-based storage. And we have strict data management procedures, which initially requires the ethical clearance before even starting to use it. And in the UK environment, we have very high level of penalty, and also we have other constraints to prevent us from misusing the data. So that applies to the clinical environment also, and also in the digital research that's happening now.
Great, thanks for sharing that and telling us a little bit more about those frameworks as well. Well, please join me in thanking Nisha for her presentation. We are very glad to have your expertise and to hear this perspective about the dental chair to data. Thank you very much.
Thank you everyone for the patient listening.